Okay, welcome. Sorry for the delay, everyone. Thank you for waiting. We're glad we have a great group on the screen, and the minister is with us. So good morning and welcome to the Council of the Americas for, I think, what promises to be a fascinating program. A little shorter than we'd hoped, but still, we're very grateful that the minister has joined us. This is part of our series on a better healthcare future for the Americas with Dr. Fernando Ruiz Gómez, Minister of Health and Social Protection of Colombia. I'd like to thank our 2021 Healthcare Series sponsors, Medtronic, Merck, Pfizer, and Sanofi, who make these programs possible. Today's program follows our panel last week with Dr. James Fitzgerald of PAHO, Dr. Javier Guzman of the Center for Global Development, a Colombian, I might add, and Mr. Tom Evison of Sustainalytics to discuss the issue of sustainability of healthcare systems insight. Their conclusions were somewhat alarming. In general, the pandemic made a bad situation worse around the region, both in terms of the financing of healthcare in the region and in terms of their ability to provide adequate services. Today, we can hear a bit about how you see the prospects for Colombia's healthcare system as you work to overcome the effects of the pandemic, and how Colombia is dealing with these sustainability issues. Before I introduce Mr. Ruiz, a website. Dr. Ruiz has a long and distinguished career of research and public service in the health field, so my brief introduction will undoubtedly be completely inadequate, but I'm going to take a stab at it. Economics from Universidad Javeriana, and in public health, occupational health from the Harvard School of Public Health. Dr. Ruiz took office in March 2020, quite a time to take up this position. Fortunately, 2013 to 2016, he's been consultant on projects with the World Bank, the Inter-American Development Bank, the Pan American Health Organization, and has served on the executive committee of the World Health Organization. Give me anything I've missed. And with that, Mr. Minister, welcome to the Council of the Americas. Thank you for the honor of joining us, and the floor is yours.
Hello, thank you for being here. Thank you for this very interesting meeting from the Council of the Americas. And I would like to say hello to everyone and to have some message from Colombia. We, as everyone knows, for the last 20 months had a very hard pandemic that has hit over the world, but with a special emphasis in the Western Hemisphere and with a special emphasis in Latin America and middle developing countries. Colombia, as other countries, decided to take a comprehensive approach to attack the pandemic and to have both the epidemiologic strategy and also a very strong health services strategy, trying to strengthen our health system to have a good response, the better visible response for the pandemic. Up to now, we have had more than 100,000 deaths and about 5 million Colombians who had been diagnosed with COVID-19. And now we have about we think we are close to 90% of prevalence in the general population of COVID-19. This is a scenario where the country had to deal with a very important shortage, mainly in the technological area, especially in the area of equipments to get to increase the intensive care units number that we had in Colombia. We started the pandemic with 5,300 intensive care beds in Colombia, and we now had up close to 13,000 intensive care beds in the complete country. We have been able to deal with the pandemic without having a big stress for our population. Most Colombians had access to an intensive care unit. Most Colombians had access to the best feasible treatment. Colombia's uh, insurance coverage is about 98%, and this assured that we were able to 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 direct all our efforts to work with the different insurers to work and to cover most of the problems for our population. We did not have problems. We did not have to share ventilators. We did not have to see people dying in the streets. We just prepared at the beginning of the pandemic with a strict lockdown for about 1 month and a half. And in this period, we did a very strong effort to build and to strengthen the capacity for the health system. And in this, we had the we were able to work with a lot of international technology companies that some of them are here. And I would like to thank from the Colombian government and from the Colombian people the big effort that you made to help us to accomplish this goal to have more than 12,000 intensive care units in Colombia. That was has been recognized for our population, and we did a big effort on that. The second challenge that we had, of course, as many other countries of the world, was the possibility to have a comprehensive vaccination plan for the population. This was not very easy because you know that the development of vaccines was very hard, very difficult, and we are but now seeing back what these developments. I think the world has to be very thankful to the pharmaceutical industry for the velocity that the industry can accomplish the development of vaccines in the world. I think that is outstanding, and this include a strong effort from everyone, and of course the effort to buy vaccines, to get vaccines, have played a burden for the finances for most countries, and specifically for the developing countries. This has been a hard issue for the budgets. Of course, for Colombia has been uh, very had we had to make an effort. However, I would like to say thank you to the companies that developed the vaccines, because we think we were able to build good relationships. We were able to negotiate at some point the possibility to have the vaccines on time. And I think these companies made a huge effort to supply vaccines throughout the world, and of course for Colombia also. So this has been very important. The main feature that we want to accomplish in our vaccination plan was equity, and to have the possibility that every Colombian, no matter the social status, the gender, the area where they live had the same possibility to have access for a vaccine. And you should know that Colombia is a very heterogeneous country. We have very large cities, more than 50 cities that are large, that had more than 200,000 inhabitants. But we also have huge, huge areas, huge rural areas where where the possibilities to get a person to be vaccinated is very hard. And of course, to have the second vaccine is even harder. But we have deal to work with our insurers, our hospitals, our primary health services to get to have the possibility to to get the vaccines to every Colombian. And we think we will be able by the end of December to have to be very close to have 70% of our people vaccinated. We already opened the possibility for vaccination for children 3 years old and older, and we also are applying boosters for people over 50 years old. So we are trying to have a complete and comprehensive coverage with the vaccines to produce and to have the best possibility to not having a hard four peak as other countries are having right now, but no one is sure about that. So we had to deal and to fight every day, every week with this pandemic with a lot of uncertainty. But this is the way that it has been done. However, we are very positive about this. Colombian strategy results having we had I think we had good results in the health area, but we also have very good results in the economic area. Colombia, and this was a very early decision in our country. We decided that we will fight against the pandemic, but we will not see the economy as in a conflict with health. We thought that health and economic in the approach to this pandemic should be working together. And the good results in that good results in the pandemic in the health area will be good results in the economic area. And we think this is the reason why Colombia is now having the second largest uh, growing uh, economic growth rate in the Western Hemisphere. And this is because we have took decisions to open the economy to at the same time developing the vaccination plan and working to get the education open, the 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 the, the business open, and to have the possibility for everyone to return to their jobs. This has been the approach for our country, and we thought that we had been successful on that, even though we are sure this has not finished yet. So we have decided to do that. What is for the future? We think that the future in the pandemic should have a continuous vaccination strategy, a continuous treatment strategy. We have very hopes about this new medicaments that are in developing and have been delivered right now. We hope to have them in Colombia very soon and to start treatments with these medicaments. We also hope that the industry will open the property rights in vaccines and medicaments, will be more open in the vaccines and medicaments property rights for the future. We think the pharmaceutical industry should have an approach to this and should have an open discussion about that. And Colombia would like to see some developments on that area. The second area that we think that is very important for a country like Colombia is to develop the health security, to develop a health security strategic plan. And we already have working in that with the National Developing Department. And this includes, of course, the production in Colombia of medicaments and vaccines, because Colombia, as a 50 million people country, cannot afford to have the next pandemic in the same lack of local production that we had in the past. This should be a main goal for the health sector, for the local Colombian and international industry, of course, and of course for the research area from the universities and academic centers in the world, in the country, excuse me. So this is a main area that we want to develop, and we hope, and we expect, we do not hope, we expect to have this as a state policy developed by the end of the second quarter of 2022. We have been working very hard on that. We already are very close to have agreements from Colombian companies, government, and the government and international companies to produce vaccines in Colombia, and this is part of the future that we need to develop very soon. For the other areas that we had to work, we had an agenda with 10 specific issues that we want to have finished before the President Duque government ends. And this includes, of course, the formulation of the National Public Health Plan, the development of some of the main surveys, public health surveys that we had a delay for because the pandemic, mainly the national health survey and the DHS survey, and we want to finish all the regulation for the development of the primary health services in Colombia. And maybe the most important area that we want to finish is a state policy for the development of the health information technology systems in the country. We are opening. We are sure that to deal with the fragmentation of the health system, we need to integrate them and the best way to integrate is to get interoperability between the different providers of health services and to develop health information technologies to be around centered in the patient and to have all the information for the future. This is not a short-term plan. This is a middle-term plan, and we are working now with the International Inter-American Development Bank and the World Bank in the way to assure to have the best health information system. We already have the law. We have passed the law for interoperability in the electronic medical record. We now have delivered for the people a Min Salud Digital. That is an application that enables the citizen to have all the information, not just about COVID, but about all the services that they should have for the cycle of life that they are, and how and it has an interoperability with the information that we have from the delivery of services that we will working that will make the patient able to ask the system the services that are planned for his specific age and in the pathway, specifically in the pathways, health pathways that we already have issued, and of course the strengthening of the financing and sustainability for the system is also a must. During the pandemic, the Colombian health system were able to maintain about 2 million people, 2 million Colombians, 2 million workers who lost their jobs during the pandemic, and we subsidize them to maintain them in the contributive regime. So we now have a system that did not lose population people enrolled in the social security. It was a big effort to maintain the people in the health system, and this is a work that could make possible the sustainability for the both from the contributive and the subsidized regime. So we are working now, finishing the what we call late punto final. That is the big effort to finish and to close all debts that the system had with health providers. And we now think that by the end of the second quarter of 2022, we will finish completely both the punto final territorial and the punto final, the contributive punto final, to assure that all these debts from the past had been covered for the system, and the new administration that will start in August will have the possibility to project the development of the system in a better way. We are having other developments in the next future. Unfortunately, the time is very short, but I want to thank everyone for the possibility to come to this meeting and to have the possibility to share this information with you. Thank you very much. I will ask Leonardo Arregocés, the Director of Technologies, to take care of the questions that you have for these issues, and I will be here for a few minutes just to for if something to be sure that everything is right in the country. Thank you very much.
Thank you, Mr. Minister. We are so grateful for you joining us. We understand your time is short. You've got a hard stop at 10 o'clock, and we very much appreciate Leonardo Agroses staying with us. And so what we're going to do, I think, Leonardo, you tell us, but if we can go a little bit past 10 since we started late, but you tell us. And I do have a question, and I want to invite others to send me a question via chat, or you can raise your hand on, use the raise hand. Don't raise your hand in person. Use it during the raise hand function. Either way, and let me know if you've got a question. So let me just ask this question quickly. That came from Juan Sebastián Estrada of MSD Colombia. That obviously we've been through enormous changes, and we were reading about. I was reading about the jump in telemedicine from 1.5 million to 30 million users over the course of the pandemic. I mean, that's an incredible change. Obviously, there are all kinds of challenges and needs on the technological front. We heard the minister talk about some of them. So the question that Juan Sebastián Estrada posed is what are these that you see on the digital data and advanced analytics front that could be supported by the private sector? Where is the private sector going to be engaged in this? How can data and digital technologies improve medicine, adherence of medicines, and promote equal access in the context of Colombia? So we've got this new digital and data economy. We've got all these new technologies. How do you see the Colombian government and the private sector working together to harness these things for the good of the Colombian people and Colombian healthcare systems?
Okay, hi to everyone. I think I know most of the people here for quite some time. Hola, Rafael. I'm head of. I'm gonna do a brief introduction of myself, and then I'll start answering the questions if that's okay with you. I'm a medical doctor. I was trained in intensive care. I worked in intensive care like for 10 years. Then I moved into health policy. I did a master's in London School of Economics in health policy, planning and financing. Then I worked for this Ministry of Health for quite some time in about insurance and also about quality of care. Then I moved back to UK, to London. I did a PhD in public health, mostly in health economics. And I came back to Colombia, and I've been working for the Ministry of Health as head of medicines since the beginning of the pandemic, like the beginning of April. I started here in the ministry, and quite a bit of my time in the last 18, 20 months has been this pandemic, although working in many other aspects of the policy about health technologies. Now, regarding the questions about telemedicine and big data and data analytics, there are many things that this ministry is working on. So right now, the ministry is working in a full, what's called here in Colombia, COMPES. It's a public policy regarding data, and especially about health data. It's mainly working around putting all the different kind of all these data sources together and making and being able to use them. Right now, Colombia collects quite a number of records from many different sources, administrative records, some health records, not many and not very clinical, are mostly administrative. We will be rolling out some pilots regarding electronic health records, which we hope electronic health records will be available very soon. It's been the ministry have been working on electronic health records for quite some time, and it seems that this is going to be the time where it will start working. So putting all these together within one whole policy that's looking at making the data available and useful, because you can put all the data together, but that doesn't mean you can use it because it's stored in different ways, because all the information might not be accurate. So there's one big policy working around health data and how you can make it available. First, for the government, for analysis within the government, but also within these policies, it's also how you can make it available for other users. Other users would be not only the public sector. You understand that, for example, finance ministry or other ministry of science, ministry of education might benefit from using these kind of data, but also from private also for private, how they can, for the private sector, how they can best use this data. So this is one of the things that the ministry is working on, how you can collect the data and put it together for it to be useful. At the same time, within the ministry, there's also getting all these rethinking, all this reviewing of how the different areas within the ministry work with the data that's available. Usually we had a centralized way of working here, where was this huge big office that would get all the data requests, and they will process them all, and then they would get outputs which were supposed to be analyzed by the different areas. But right now we understand that with the huge amount of data that's available, every area would have different needs, and it's not very efficient having a centralized process. So we're going back again to decentralized process with this office. That's the one, this central office, it's in charge of putting the data together. And then all the different areas are in charge of their own data analytics, designing their own dashboards, understanding what's the data requirements they have and how they will best use it. So that's what we're looking at. And we hope that definitely data analytics will help us work around more clinical aspects, for example, adherence to treatment. We want to understand more about access to healthcare and how different regions in the country have access to different health technologies. Within my PhD thesis, I found that, for example, the rate of uptake of new medicines may vary quite a bit across the country. And for example, for very innovative and very useful technologies, you would want to have faster uptakes of more of technologies that are showing the best results. So that's one of the things that the ministry is working at right now. We have one of the big plans for the following year. For example, these telemedicine is running these food analysis and get all the lessons learned of what was the benefit of increasing the? Access to healthcare through telemedicine in such a big proportion. Did it work? Did it didn't work? Which areas did it work? Which areas didn't work? What were the challenges there? For example, we know for example, from people that supply medicines, that they distribute medicines, they had huge issues because the medicines during the pandemic had to be delivered mostly to the elderly at home, which are the ones, which the population that, even if it's not a very large population, they do use quite a bit of medicine. So some of these medicines distributors told us that they ran from having, for example, that they were delivering sort of a few million to hundreds of thousands of deliveries per month. They jumped to millions of deliveries per month, and it was quite challenging. So what we want to see is how best put the data together, how to make the data useful, how you can make the best of these data, and how you can make it available for other sectors to use it. It has to be anonymized. Colombia has a very strict policy, a strict law about data sharing, which cannot have some sensitive data, but we have to go over that and make it available for sharing. That's going to be quite an issue. That's not going to be fast. That's going to take some time, but that's within the radar of these ministries, how you can move faster with sharing data and analyzing the tons of data that these ministries collect.
Thank you so much for that. It's a new world, right? And it sounds like the ministry is working very hard to try to make sure that at the same time it's protecting people's data, it's also allowing it to be used to their benefit. So that's great. And I know that the private sector, our members, definitely want to work with the ministry in regard to making sure that that can happen in the most effective way. Let me switch gears to the issue of, that the minister raised briefly about the efficiency of the health sector, making sure that the people's money is being used as efficiently as possible on healthcare. And obviously, the pandemic has put a huge strain on systems that weren't always in the best shape to begin with. What is Colombia looking at doing in addition to what the minister mentioned of making sure that suppliers are paid and all that's cleaned up, these debts and so on? What is Colombia looking at doing to make sure that going forward, coming out of the pandemic, the healthcare system can deliver the services it needs to deliver in a sustainable way financially, as well as in an equitable way, obviously making sure that those services are out there where they need to be among the people? How, are you looking at innovative financing mechanisms, sustainability bonds? What's going to be the answer to that problem for Colombia? Or what do you hope will be the answer to that problem for Colombia?
Well, yes, Colombia has faced this issue about flow of resources has been slow. And these, the Ministry of, or the time that we have in office here until August next year. So some of the plans looking until August next year have very different, they focus the different aspects that's trying to solve this issue with the flow of resources. It's not only for solving the issue of flow of resources, but if you solve the problem with flow of resources, you'll have better access to healthcare, which is the central part of this is people and how you can provide better access to people. And better access to people, it's also about financing and flowing the resources from the government to health insurers to providers. So there are many things that we will be working, as the minister told you, these ley de punto final, these about recognizes previous debts that had not been paid and pay them and try to start from zero. It's something that's working fine. The Vice Ministry of Social Protection is working hard, and they have a commitment that by the end of this year, many of these debts have been recognized, they have been organized, and payments can start. So that would be really important, a really important flow of resources. Then, on the other hand, the way the premium for healthcare is being calculated here in Colombia will have some very important changes. What we'll have in here, that's called presupuestos máximos, like maximum budgets for some specific health technologies. We'll start a plan of moving everything to a single premium that will cover most of the health technologies there. And these premium would be estimated a bit more accurately. There would be some other, there would be including some better ways of risk stratification of the population, so that this premium, it's ex ante calculated more precisely according to the population. So that would definitely help. That would have definitely a better flow of resources from the government to insurers. There's also a big work right now on how insurers and providers have their contract relations, have something that works easier, that's faster, that opens the way for them to have innovative ways of contracting. Here in Colombia, we have a lot of fee-for-service, way much that you should need. It's pretty inefficient because fee-for-service, it's probably the main way of how insurers and providers relate. Their contracts are mostly fee-for-service, which is a big issue for efficiency. So these complete review of how these insurers and providers, they relate and how these contracts should work and how the flow of resources about billing, about different things should work, that's going to be very important. So that will also be helpful in the future. And we're also working in many other aspects. For example, we will have a very specific review of the price referencing for medicines. For medicines, so we will do some very specific tweaks to the methodology about price index for medicines and about the way they're grouped and how you identified medicines that will be going to the international price referencing. We plan by next year to have implemented managed entry agreements, which is going to be very important, especially for these innovative drugs that do add value. Managed entry agreements are going to be very important. We will also include, or we will operationalize these what we had in the law previously that we know as the gate of entry, or artículo 72, puerta de entrada, where we will be much more clear how medicines get their price set at the entry. And definitely with this process, we want to be sure that what INVIMA does about licensing drugs and the price setting of the drugs are two processes that run in parallel, but that doesn't mean that a drug will not get a license because it's not cost effective. That's one of the things that has been very complicated, and the industry has been very worried about what's going to happen with that. Our understanding of the law, it's very clear that the health technology assessment that has to be done within this mechanism, it's going to be useful for setting the price. It's not conditioning if they get or not a license. So we want to implement that process very clearly, so there's no problem with the market or with the industry, and everyone gets very clear that health technology assessment in this case has a purpose, and it's getting this data for the national commission that sets prices for setting a price, not for granting a license. And we're also working, and at the same time, one of the things we're working is having this national system that would monitor and would have very early alerts about shortness of medicines and other health technologies. That's something that has been very important, that as a country, we don't have a system that's monitoring for shortages of medicine. So we want to implement that. And we hope that with these interventions, that's the ones that we plan to have working by August, when this administration finishes, to have a very good impact in access to medicines, and the sustainability of the system, how the financial resources within the ministry are flowing much better.
Thank you. We're over time, but I'm going to ask one quick follow-up question that just came in with regard to the timeline for implementing the single premium, the UPC, whether that's something that people will see in the short term.
Well, right now for next year, definitely there's going to be these presupuestos maximum budgets, but for how the premiums being calculated for next year, I know there will be some upgrades, some changes that are going to be very important. For example, taking into account diagnosis. The diagnosis of the patient just by itself, it would explain I think it's between 18 and 20% more of the variance between the usage of services between people. So just by including that within how the premium is estimated, it's going to have a big impact on how premiums are estimated. But the idea is, because this has to be within a path, I'm not sure how soon these presupuestos maximums, these maximum budgets, would be removed, but the plan is to have it removed and move everything into a single premium as soon as possible.
Thank you. Thank you so much, Leonardo. Really appreciate you staying with us. We have actually a very dedicated audience that stayed with us as well. So, but we are going to call time since we've kept you 15 minutes over. I just want to say how impressive it is that not only the minister, but you have been able to pinch hit, to use a sports analogy. And obviously, the ministry has a very deep bench, to use another one. And so we really appreciate your time as well as the ministers this morning. We wish you every success in what is really one of the most important and complex policy decisions that any country has to make. I want to conclude by thanking our 2021 healthcare sponsors, healthcare series sponsors again, Medtronic, Merck, Pfizer, and Sanofi. And I want to thank all of you who joined us today, stayed with us a little longer. We look forward to having you back for future programs on our healthcare series. We wish everyone who's in the U.S. a happy Thanksgiving this week. And until we see you again, please stay healthy. Thank you so much, Leonardo. Thank you to all of you, and have a great week.
Thank you.
Bye.
Thank
Thank
you,
you very
Leo.
much for your time.
Ciao,
Have a
ciao.
nice day.
Thank
Adios.
you.
Leo.
everyone. Bye-bye.
Bye.
Bye.